Hello, my name is Holly Haynes, and I'm here to present a strategic planning initiative here at Medical Center Hospital. The mission of Medical Center Hospital is that we are a teaching organization and we're dedicated to providing quality and affordable health care and improve the health and wellness of all the residents of the Permian Basin. We have a vision that we will be the premier source of health and wellness of the community. Many patients in the hospital receive a survey from a company called Press Ganey. This survey measures areas of improvement and patient satisfaction. On the oncology floor, we have had several months in a row where our patient satisfaction score has been low in regards to pain management. Our goal for the entire hospital is to have all the topics greater than 90%. So we needed to come up with a plan where we could get greater than 90% on patient satisfaction relating to pain. We needed to figure out how we could do this. So the first thing we did was we set a unit meeting, and I empowered everybody to come up with one idea apiece on how we could improve pain management on our floor. On the oncology floor, we deal with many types of pain. There's chronic pain, acute pain, nerve pain, anxiety that presents as pain. There's many opportunities for us to help improve patient comfort. After a week, everybody re-met and they had their idea in hand. We discussed all the ideas and selected 4 that we felt like could help improve our scores. The first is the verbiage that we use. When we generally go in and ask a patient about their pain, we ask them, "Are you having pain?" With this new initiative, we decided that we would change the verbiage to say, "Is your pain controlled?" The reason we chose this is because the topic sent out by Press Ganey says, "How well was your pain controlled?" So we felt like if we use the term, "Is your pain controlled?" when they got the survey, they would remember that we made interventions. The second thing we decided to bring back was hourly rounding. Hourly rounding is something that's not new to nursing and it's not new to our hospital. Over the last couple of years, it's turned into every other hour rounding. So we decided to make it every hour rounding, and it would alternate between the nurse and the nurse's aide. Each staff member that went in to check on the patient was to ask them if their pain was controlled every hour. We felt like this would give us opportunity to make an intervention when the pain was still at a 2 versus a 10. The next thing we did was budgeted and ordered comfort kits. These kits were given out to all the patients on the oncology floor, and they contain things that could help provide more comfort, such as earplugs, heat pads, a mask, a sleeping mask, so that the room could be darker if they're trying to sleep. These were handed out on admission to every patient by the unit director. The unit director implemented nurse leader rounding. This was done on every new patient and most patients on the unit. During this rounding, she would set expectations on what we were going to do and what the patient needed to do. She let them know that they needed to call for medication, that it wouldn't be brought in unless they requested it, and she made sure that they knew how to access the call bell and the call system to get the nurse. During the leader rounding, the unit director also had the opportunity to evaluate patient satisfaction and if the nurse or the staff was perceived to be doing what they needed to do. The next thing we had to talk about was how we were going to measure success for this initiative. One way we decided we were going to have monthly meetings with the entire unit. At this monthly meeting would be a chance for nurses to give any feedback on how they felt like our interventions were going. And we would also review our monthly HCAHPS scores that's provided by our PI department. At this time, we were able to monitor whether we were having improvement or non-improvement. And if there was no improvement, then we knew that we needed to make some changes. We also met with our divisional director and the chief nursing officer and explained our plan for improving our HCAHPS scores. And we talked about how we were going to measure it, and we talked about budgeting our pain kits. The leader rounding really is the final step where the unit leader has an opportunity to make a change or identify a problem quickly, and therefore we can make changes. We're going to wait 2 months after the initiation to give the plan time to work and the results to start to raise. And then we'll evaluate monthly for the rest of the year, and we'll monitor if the score goes up or down. Thank you.